Hello everyone, welcome to Medicine in Practice. I am Sana from M3 India. Today we'll be talking on the topic of transgender health. We have a very known guest today, Dr. Sanjay Kalra. Dr. Sanjay Kalra is DM endocrinologist at AIIMS New Delhi. He is also a consultant at Bharati Hospital, Karnal. He is a president at Indian Professional Association for Transgender Health. He has also been elected as president at South Asian Federation of Endocrine Society. He was also the past president at Endocrine Society of India. He has been the board member at International Society of Endocrinology. He is also section editor in endocrinology, API textbook of medicine, tropical endocrinology, Endotex, the PubMed Index textbook, and so on. Dr. Sanjay will be answering some of the important questions on this topic. So, hello, doctor. A warm welcome to you.
Thank you, Sana.
Yeah. So going straight towards our first question of today. So can you please throw some light on gender dysphoria and transgenders?
Thank you, Sana. This is a very important topic, and it's important for all of us to learn this. Now, we all think in terms of binary. Let us say we think about living beings and non-living beings. So we think there are only two. Or we think about plants and animals. We think there are only two things in the classification. But actually, there are many organisms which have some features of living beings, some of non-living. And there are living beings which have some features of plants, some of animals. So we must understand that this construct, this binary construct, is for convenience, for us to learn, for us to just create a structure. But everybody doesn't have to follow that structure. Same thing happens in gender.
Right.
We are assigned a biological sex at birth, which can be male or female. And most of us tend to correspond to that particular sex. But there are some individuals who may be having a male body, but inside they think that they are female or vice versa. This is what transgender means. And when this issue of discordance between the assigned sex and the real sex, what you are from inside, when this becomes a little bit too much, that is gender dysphoria. It means there's an identity issue, and that dysphoria or dysmood, the wrong mood, is creating health issues. That's what gender dysphoria is.
Okay. Thank you so much for acknowledging this definition. Moving to our second question, what is gender affirmative hormonal intervention?
So let us say we have an individual who is born or is classified as a woman. But that individual inside thinks that he is male.
Okay.
So he would want to have his body contour, his external appearance look like that of a male. He would want to avoid the features of being female. We would term this a trans man. And the opposite, a trans woman, someone who wants to shift from a male identity to a female identity. When we try to help them live their choice of gender, note the fact, their choice of gender, we want to help them affirm their gender, their chosen gender, and we can help it. How do we help it? With something called gender affirmative intervention. This intervention can be medical, it can be psychological, it can be surgical. And when we use medical intervention or hormonal intervention, that is what we call gender affirmative hormonal intervention.
Right. Thank you so much, doctor. So what drugs can be used for gender affirmative hormonal intervention in trans men and in trans women?
So let's take trans men first. So here we have to suppress the feminine aspects and we have to improve or enhance the masculine aspects. So the choice of therapy is testosterone. We can use oral capsules. They're not used very frequently. We can use gels. They are a bit expensive, but they are easy to use. And they give a sustained, a very uniform level of testosterone in the body. So you apply one gel, 5 ml, once a day after taking a bath over the abdomen and over the chest. You can also use injections. Injections are the most economical. And we have injections available which can be given every 2 weeks, every month. There are even injections that can be given once in 90 days. So the individual has the choice of using any of these. These are all androgenic. Usually testosterone will suffice, but there will be some people who will be needing extra therapy, maybe to stop periods, to stop menstruation. Then you can use drugs known as GnRH analogs, gonadotropin releasing hormone analogs. Some examples are triptorelin, buserelin, leuprolide. These are also given monthly or 3 monthly. They are a bit expensive, but they help in suppressing menstruation and in improving gender dysphoria. A cheaper medicine that can be used if GNHRA are not affordable or not accessible would be medroxyprogesterone, available as tablets and also as injections. Let's talk about trans women. In trans women, we would want to enhance the feminine aspects and we would want to suppress the androgen. So here what we give is estrogen. Estrogen can be used as patches or gels. Gels are available in India, but again, they're expensive. So injections are also available, but they are not very uniform, not very consistent. So usually it is tablets which are used. 1 tablet a day. You begin with a low dose and you improve gradually. And along with that, you have to give anti-androgens, a drug like spironolactone, which reduces testosterone level. So this is what trans women use for gender affirmative hormone therapy.
Okay. Thank you so much, doctor, for answering it. Moving to our next question, endocrine management in children and adolescents.
This is really important, and thank you for raising this, Sana, because this has been a matter of unnecessary debate in our country, just unnecessary debate. Now, you just imagine a child. The child is entering puberty. Changes are occurring. The child is becoming feminine. But inside, the child wants to be a boy, wants to be a man. Or the child is growing a beard and a mustache. But inside, the child wants to be a she, wants to be a woman. Now the child is just 12 or 14 or 15. You do not know what the future will be. So you want to give time to the child to think, to reflect, to adjust to life. The easiest way to do that is to just postpone puberty. So the colloquial term that we use is puberty blockers. The correct term would be GnRH agonists, what we mentioned just now. What these GnRH agonists do is they prevent the maturity of the master gland, the hypothalamus and the pituitary in the brain. So by suppressing that, they are able to postpone puberty, and you're able to give a window for thought, a window for reflection to the child and to the family. So until the child comes back and says with confidence that, yes, this is my chosen gender, I want to be male, I want to be female, or I want to be they, I want to be fluid. Until then, you give a breather to the child. So this is the treatment in adolescents and in children. Along with that, we have to remember that we have to give calcium, vitamin D, and ensure overall holistic psychological and physical health of the child. So this is very important, and we should not neglect this field.
Right. Thank you so much, doctor. We're moving to our last question for today's session. So how can we make our healthcare system trans-friendly and trans-sensitive?
It's up to us, Sana, and it's up to everyone who is listening to this podcast.
Correct.
I'm reminded of a parable from the Bible. And so what Lord Jesus said was, there was a question raised to him by some people. So he said, you're all shepherds. Let us say you have 100 sheep. If one of them gets lost, one of them goes astray, will you not leave the other 99 in safe hands and go out in search of that single sheep? The answer is yes. So if you are a doctor and you have 100 patients, even 1 or 2 of them have gender dysphoria. Maybe 5 or 10 belong to the LGBTQ community. Whose responsibility is it to take care of them? It is our responsibility. We cannot neglect that. It is our patient's right also to be taken care of.
Right.
How do we take care of any individual? How would I want to be spoken to by any other healthcare provider, any other service provider? Whatever way I wish to be spoken to, I should speak with Sana, and I should speak with each and every patient of mine in the same manner. How would I want to be listened to, Sana, when I am saying something? The same way I should listen to each and every patient who comes to me. If we can internalize this, then suddenly we become patient friendly, person friendly, public friendly. We become patient sensitive, person sensitive, public sensitive. Now that we've achieved that, then we talk about transgender sensitivity and friendliness. So take a minute to understand what a transgender person goes through, what a transgender person's concerns are, feelings are. How does that person want to be addressed? Do they want to be addressed as him or her or as they? If you don't know, just ask, but ask politely.
Right.
Ask with the empathy. Ask in a sensible manner. Don't be rude. And I think if we just do this, each and every doctor, each and every healthcare professional in India, if we just internalize this humanity, and not only internalize, express it as well, externalize it, then I think the problems that our transgender community faces, they will be taken care of. And also the problems that the healthcare system is facing today. The healthcare professionals are also facing a lot of problems, Sana. Violence, verbal and physical violence from the public.
Right.
If we take the first step towards being sensitive, towards being friendly, I think most of these problems that the world is facing will be taken care of. So it just begins from within us, but don't keep it within you. Externalize these feelings.
Sure. It was nice having this opinion in front of our all the participants. I am definitely sure that by listening to this session, this is very sensitive topic. Normally people don't come up and talk, but I know that even they are human, so even they have the feeling, so
Yes.
we should treat them equally like us, because they are also human. There is
Yes.
so it was a very good interaction, Doctor. So to sum up this session, would you like to add any last comment of yours?
Be aware that apart from masculine and feminine, there is a third gender, that is transgender. Transgender itself is a wide spectrum, a very wide spectrum. But just for ease of understanding, trans men and trans women, and also special concern for the children and adolescents who come to you. Just be friendly, be sensitive, be aware that we can help them with psychological support, with hormonal support, that is gender affirmative hormone intervention, and also with surgery if required. Help them to the best of your ability. And if, let us say, you're not specializing in this field, do refer them to the right healthcare professional, which can be a mental health professional, an endocrinologist, or a surgeon who deals with transgender surgery.
Right. Thank you so much, Dr. Sanjay. I'm sure by answering all this question, this would have definitely cleared many of the doubts of our audience. And thank you for sharing your knowledge with us. We are glad to have you, Dr. Sanjay.
Thank you for the opportunity, Sana, and thanks to everyone for listening to us.
Thank you.